Can neurological disorders affect the genitourinary system? Have you ever wondered how neurological disorders can impact the genitourinary system? The answer is yes, they can have a significant effect, especially on bladder function. The genitourinary system includes the kidneys, ureters, bladder, and urethra. These organs relying on complex neurological control to function properly. The brain, spinal cord, and peripheral nerves work together to manage bladder control. When there is a disruption in any part of this neural pathway, it can lead to issues with how the bladder stores and empties urine. For instance, conditions like spinal cord injury, multiple sclerosis, Parkinson's disease, and stroke can impair the signaling needed for normal bladder function. This impairment may result in urinary incontinence, retention, or other bladder issues. People with neurological disorders often experience symptoms such as urinary urgency, frequent trips to the bathroom, and difficulty controlling urination. These symptoms arise because neurological damage can cause the bladder to contract too much or disrupt the coordination between the bladder muscles and the urinary sphincter. This dysfunction can significantly affect a person's quality of life and may also increase the risk of urinary tract infections. Understanding the neurological basis of bladder control is essential for effective diagnosis and treatment. Healthcare providers may use various therapeutic approaches. These can include medications aimed at regulating bladder muscle activity, catheterization techniques, or neuromodulation therapies that target the nerve pathways involved in bladder control. Research is ongoing, and there is hope for innovative treatments that can restore bladder function in patients with neurological impairments. For instance, studies into spinal cord blood flow dynamics during bladder filling and emptying may lead to new therapeutic options. In terms of bladder cancer management, neurological disorders affecting bladder function can complicate both surveillance and treatment. Impaired bladder emptying can increase the risk of infections and affect the reliability of urinary biomarkers. Therefore, a comprehensive care approach for patients with neurological disorders should include careful evaluation and management of genitourinary symptoms. This strategy is vital for preserving bladder health and optimizing cancer treatment outcomes. In conclusion, neurological disorders can profoundly disrupt the genitourinary system, particularly affecting bladder control. By advancing our understanding of the neural mechanisms involved, we can explore promising treatment avenues to improve bladder health for those affected. If you or someone you know is experiencing urinary symptoms related to a neurological condition, it is important to seek specialized medical evaluation and tailored management.